Some of the drawbacks of telehealth for providers that really have limited the adoption more widely in the past have been concerns about reimbursement. But as I mentioned, we are hopeful that that's going to carry forward both at the state legislative level, regulatory level, as well as federal, to ensure that there is, if not parity, then some type of payment equality for these services. I think sometimes providers do feel at risk and exposed providing telehealth visits because it's not as comprehensive in terms of physical examination. And so there's worry about misdiagnoses, there's worry about not giving as comprehensive an assessment to a patient. There are unusual circumstances that providers face where a patient may be in distress or expressing suicidal ideation or having other crises, and you're in a virtual environment with the patient during that crisis. So how do you handle that compared to how you would normally do that in person? For patients, I think the largest drawback has been access. So do patients have appropriate devices? Do they have access to broadband? And that's been a huge focus of a lot of both private equity as well as public and governmental efforts to ensure that there is broadband and internet access across rural areas and also in urban centers for patients to be able to avail themselves of this modality.